My mom.
My father.
My father. My uncle.
My family.
My father.
My grandmother. Watching her go through health difficulties with a stroke in her early 80s and how that really affected her life. And being very close to her inspired me to be that person for someone else's grandmother or family member.
If I had to choose one person, it would be my father. He has polycystic kidney disease. 12 years ago, he received a kidney transplant from his sister. So I saw the beauty of medicine. I also realized how important medicine is, but love and support is. And he wouldn't be here today without one or the other.
My inspiration for coming into medical school is a little bit non-traditional. I worked for about 10 years before medical school. So it was kind of a pathway of self-discovery. I was trying to figure out what's going to make me happy. And going through different industries, I didn't feel like I was doing that. At the time, it's very queasy around blood, so I was like, let me just go into medical devices. And our first patient interview after we implanted the device, to see their excitement in being able to be alive and to be able to provide for their family and to be around for their kid to grow up, I felt the warm fuzzies you get. I was like, this is what I've been looking for like this whole time.
I think burnout.
Burnout.
When you're burned out in medicine,
Have this disconnect between the effort you're putting in and the result you feel like you're getting out.
You look at your patients as just another thing in your day instead of a human.
After studying more and more and more and being in the library for 8 hours a day and reading, you start to detest it. I'm like, God, how many enzymes do we need? Like, why?
You just want to get out of that room because you want to go home and have some sense of normalcy in your life.
For days at a time, or weeks at a time, or months at a time, even a part of a career at a time. Those are the instances where I think the burnout becomes the most obvious and, again, the hardest to fix.
I think the thing that keeps me motivated to continue working hard in medicine is
at the end of the week to go to a clinic and be able to see how what I'm learning actually relates to patient care.
and that one day I get to be the doctor. I get to be the one that uses everything I learned in medical school these past 4 years.
Because I think it's really hard when you're getting bogged down in all the details you have to learn. So it's good to have like a reality check once in a while and take a step forward a couple of years and see what I'm doing this for.
When we're rounding as a team and you have your medical students, your residents, your sometimes fellows and attendings, and you huddle outside a patient's room and you have a discussion, then you go in and seeing every person on the team interacting and really working together to provide that excellent level of care, and seeing how that translates to communicating with the patient and ultimately treatment of the patient is really my favorite part.